Neglected tropical diseases, NTDs, affect over 1 billion people globally, 40% of whom live in Africa. NTDs can be prevented and treated, yet they continue to disfigure and disable devastating lives, preventing children from going to school and keeping communities in cycles of poverty. These infections are enabled by the lack of safe water, poor housing conditions, and lack of sanitation. Children are the most vulnerable to these diseases, which each year kill, disable, or invalidate millions of people who often suffer from social exclusion for the rest of their lives. In an effort to put an end to the diseases, the World Health Organization's Regional Office for Africa set up the Expanded Special Project for the Elimination of Neglected Tropical Diseases. ESPEN aims to rapidly reduce the burden of the 5 NTDs, which could be avoided through preventive chemotherapy. 2012 marks an incredible year in the fight against NTDs. Inspired by the WHO Roadmap on NTDs, NGOs, pharmaceutical companies, donors, and endemic countries all pledged to work together to enable more than 1 billion people suffering from NTDs to lead healthier and more productive lives, helping the world's poorest build self-sufficiency. In the past years, 10 pharmaceutical companies donated over 17 billion in drug donations. In Togo, close to 11 million preventive treatments were collected and distributed to endemic districts from 2000 to 2009 to defeat lymphatic filariasis. After decades of relentless efforts, Togo, one of the smallest countries in the world, has just become the first nation in sub-Saharan Africa to eliminate lymphatic filariasis as a public health problem. Following the recommendations of the World Health Organization, Togo first aimed at stopping the transmission of the disease to protect future generations by preventing new cases. Their second strategy referred to the management of people already affected by the disease and suffering from its complications. Overall, more than 3,000 community health workers, hundreds of nurses, and members of the health district management teams were trained to execute the national strategy. Their concerted efforts allowed the country to achieve annual therapeutic coverages ranging between 75% and 85%. From 2006 to 2015, the country's program conducted surveillance activities and tested thousands of thick film slides and blood confetti. The country also ensured to leverage efforts made for the control of other diseases such as malaria and included in its communication with affected communities the need to use long-lasting insecticide-treated mosquito nets as they effectively protect against both malaria and lymphatic filariasis. Togo's LF elimination story illustrates public health at its best and demonstrates what ESPEN is trying to achieve. By helping health technicians, partners, and community health workers to come together with a clear objective to improve the lives of millions of the most impoverished people, ESPEN gives a second chance at life to those affected by NTDs. Being characterized by innovation, public-private partnership, and data-driven technical leadership, after 1 year of implementation, the special project shall provide the essential platforms that will allow us to have more success stories such as Togo. By supporting national programs in their efforts to reach the most remote communities, ESPEN and its partners give a message of hope for an Africa free of neglected tropical diseases. In 2012, the international community set new targets to enhance the control, prevention, elimination, and eradication of NTDs with the WHO Roadmap on NTDs. 5 years later, massive coordinated efforts have brought together private sector companies, NGOs, and communities from the most remote areas, proving us that we are on the right track and that elimination is within our reach.
Jogba voin, da ola nunya to jojo maka.